Hey guys, we're going to cover some infectious disease stuff. This year I wanted to do something a little cool. So first things first, this is a crate that's been put together by Bruce. It's already been blessed. It's ready to go out in about 20 minutes. So what I'm going to do is flip the lights off and let's see how clean this equipment is so we get a nice baseline. Alright, so I got my black light here. Here's the radios, and you can get a good shot of that. That actually looks pretty clean. So good stuff there. Again, that looks pretty clean. These are the new radios. The keys all look to be in pretty good shape. Although, yeah, it's actually in pretty decent shape. Get a look at the battery. That looks good. All right, and then EPCR tablet. And look at that. It's actually pretty clean. So it looks like this crew, whoever had this before, did a pretty good job of cleaning their equipment. All right, so next step is I got some glow germ right here. This stuff is, it's a hand lotion, it's just regular lotion, but it's got a fluorescent dye in it. We use it in EMT school and paramedic school to teach hand washing. So as you can see, I'm just gonna put a little bit here, and then if you wanna kill those real quick, you can see it fluoresces. So, and then we use this, normally you put it all over your hands, and we'll see how nasty your hands get. So what I would like to do is smear this all over the tablet. All right, so we got the glow germ. As you can see, my hand is very nice and fluorescent now. So, and we go to the tablet, and we can also see that the tablet is nice and nasty. This is, again, it's just regular hand lotion. It's not toxic, anything. But this is going to simulate, let's say, somebody coming to work with a cold. So somebody will sneeze, maybe they'll wipe their hands, maybe they wouldn't clean them entirely, they don't sanitize, and then they go to work on the tablet. So that's going to simulate that. So, and as you can see with the light on, if you look at it, you can't really tell a whole lot's there, although we will just kind of clean this up a little bit and let it dry, so that hopefully the crew won't notice anything. Alright, so next step is we'll get the keys and the radios. So we'll put this on there and see what that looks like. Alright, I'm gonna cut that. Keys, radio. Alright, so again, it's nice all over there, and as you can see, it is now all over the radio. I got the battery, one or two of the batteries. You can see the radio, the antenna, and then all over the keys as well. So we have sufficiently contaminated this. Again, this is going to be an employee who shows up to work sick. Their nose is running everywhere. Maybe they're not being super diligent in cleaning their equipment. So this is what you could be getting at the start of your shift.
Hello there, Josh Hoover here, and today I want to talk to you guys about bloodborne pathogens. So in this section of compliance training, we're going to talk about bloodborne pathogens and the infection control process, especially in regards to being exposed to a bloodborne pathogen. We're also going to talk a little bit about the infection control officer, which is me, and some of the roles and responsibilities of what goes on when you're exposed. So, first of all, what is an exposure exactly? Well, an exposure can be a number of things. Most commonly, an exposure is going to be a needle, a dirty needle that's been inside of a patient that happens to be stuck in your arm for whatever particular reason. So that blood-to-blood transfer from that needle is going to be considered an exposure. Also, too, another common one, and one that is definitely preventable, would be an exposure to the eyes. So if you get blood in your eyes from another person or a patient, that would be considered a bloodborne exposure as well. Another type of exposure would be if you have like cut skin, an open sore, and you get a good amount of blood on that arm and into that wound, that's going to be also a bloodborne exposure as well. So you can also get blood in your mouth. If you get blood in your mouth, that also too is considered a bloodborne exposure. Now, very rare instance where it would actually transmit into a disease, but we would want you to get tested. Now, let's say you are actually in fact exposed. So what are you going to do? Well, the first thing I want you to do is not to panic. But what I want you to do is I want you to try to wash away whatever exposure you may have. So if you've got blood on your arm and it's in an open wound, I want you to try to use whatever saline that you may have there or anything there that you can, soap and water if you happen to be at the hospital, wash that off as soon as possible. If you've had a needle stick, what I want you to do is I want you to actually pinch the site, try to promote bleeding. That in fact actually will help prevent you from possibly transmitting a disease. Now it's not 100% foolproof, but it's definitely something you want to try to do. So that way you aren't it decreases your chances of actually transmitting a disease. Now, the one thing I don't want you to do when you're trying to promote bleeding is trying to suck out the blood. It's not a snake bite, so you don't want to do something like that because actually you're just putting dirty blood in your mouth and exposing yourself even more. So please don't do that. So once you've actually got that taken care of, once you've washed with soap and water or you promoted some bleeding, you've covered up whatever open sore you may have had with a Band-Aid, once you've done all of that, you want to go ahead and make sure that your patient's obviously placed in a bed. Notify the nurse that you did have an exposure and you'll be calling your infection control officer. The next step you want to do is then go ahead, give me a call, and the phone number is going to show up right now. So that way if you don't happen to have it, please, right now if you can, please write it down so that way you guys have it and you have access to it whenever you may need it. Now, once you give me a call, there's a couple of things that are going to happen. First of all, I'm going to ask you a series of questions. And the reason being is that there are a lot of individuals that don't necessarily have a lot of background in infection control and may think they have been exposed or aren't sure if they were exposed. So there's going to be a lot of questions that I'm going to ask you, and that's just to basically verify and make sure that you actually in fact were exposed. Once it is determined that you are exposed, at that point I'm then going to notify your supervisor and also the comm center to put you out of service. Now I'm going to have your supervisor come meet with you because you were exposed. This is considered an incident, so there will be some incident testing that will go on, and that is what they're going to be there to help you do, as well as also try to help facilitate getting source patient testing done. Now the first thing they're going to do is when they do test a source patient is they are going to do a rapid SUDS test. That's going to test to see if the patient has HIV. In most cases, from what I've seen, we've really gotten those results back pretty fast, generally within an hour. So by the time you're just about to leave the hospital anyways, usually you have your testing done. The other testing as far as hepatitis C, B, A, all that other kind of stuff they're going to test for STDs, that stuff usually comes later, so that can actually take a couple of days, just depends on how fast they're able to get the stuff to the lab, but we will get those results and they will get those results available to you. Now, what are we going to do after we get the source patient tested? So obviously we've got to do something about you. So generally speaking, what we're going to try to do is if it's Monday through Friday from 8 to 5, we're going to want to try to get you to Lakeside. Lakeside is actually a group of individuals or a clinic that we use at Sunstar for workman's comp type issues, but also for bloodborne pathogen as well. So you'll actually see a physician or mid-level there that will actually evaluate you. They'll also do some testing to get some baseline testing from you as well. And they'll go over basically your risk factors based on what you tell them, how what the kind of risks are associated with you possibly transmitting a disease. And they'll also base a lot of that off of the results they get from the source patient. Now, if for whatever reason you're at very low risk, they may not actually in fact recommend giving you any PEP meds. But if you are somebody that may be at high risk, at that point they probably will recommend PEP meds. And the PEP meds that they recommend are going to be for HIV only. As of right now, there's unfortunately no type of prophylactic treatment for hepatitis C, so unfortunately we can't do that. As far as Hep B is concerned, you should already be immune to Hep B working here at Sunstar. If you are not immune to Hep B or do not have a titer that proves that you are immune to Hep B, please come see me as soon as possible and I will get you to Lakeside so that way we can make sure that you have that. There's really no excuse to not be immune to hepatitis B, so that really shouldn't be an issue. But again, if you don't have it done, please let me know so that way I can get that done. So now, after you've been evaluated by the physician, at that point there may be some follow-up visits, just all depending on their blood work and results from the patient. So ways to prevent this stuff from happening to you, I can tell you definitely using your appropriate PPE. One of the most common things that I'm seeing out there is people are getting blood in their eyes, and honestly I'm not really sure why. We issue you glasses at orientation, and then also too there are safety glasses that you will find on your truck in one of your action areas. So definitely please make sure you're utilizing that appropriate PPE. So exposures actually don't just involve necessarily clinicians. It can also involve a VST, it could also involve a mechanic, even somebody in admin. If there's blood on paperwork, you may accidentally get exposed. Maybe you got a big cut on your finger, you happen to accidentally touch some blood on the paperwork, that can happen. If you're a mechanic and you happen to be working on a truck and there's unfortunately a needle that's been in another patient's arm and you happen to accidentally get stuck by it because you didn't see it. You know, these types of things can happen not just, like I said, to clinicians, but can also happen to our other administrative staff as well, including our BSTs and mechanics, or even our warehouse people. So if that does actually in fact happen to you, again, call the DO hotline number. You're going to be able to see it up there in the video. Put it in your cell phone, have it readily available. Give me a call. Again, I'm going to work with you through this. If for some reason you can't get a hold of me, please, please, please call the supervisor or whatever supervisor's on staff or nearby. Let them know what has happened. They will actually then at that point contact the DO that is maybe covering for me, or the secondary DO that can also answer the phone as well. Because again, we're all human beings and we have things also in our personal lives, so sometimes it may not necessarily be capable for us to answer the phone at that particular time. We don't do it on purpose, but again, sometimes things come up and we're just not able to answer the phone right then and there. So if that's the case, again, notify your supervisor. They can then notify the secondary DO as well as also the comm center. The supervisor can also put you out of service as well, so that way you can get the proper testing and try to get things started. And then again, always keep trying to get a hold of me if for some reason you can't, and sometimes, like I said, I may not catch it right away, but give it a few minutes and I may actually be near my phone and be able to answer that call. So again, if you have any questions, please call me. I'm always available 24 hours a day, 7 days a week. You can call me on my personal phone, or actually on my work phone at 727-224-2110, or call the DO hotline and I'll be sure to answer that phone as well. Hope you guys have a great day, and I hope you enjoy the rest of your compliance training.
Alright, hey guys, so it's about 12 and a half hours later since we sent that crate out with the crew. So they're back, they've now gone home. No, I'm not going to tell you who they were, but we're going to see how they did, see how much of the glow germ, remember we put it on the keys, the radio, and the tablet. So we're going to see how much of that stuck, how much they were able to clean off, and then if any of it got anywhere else in the truck throughout the shift. There's something nasty on the earpiece of this stethoscope. So remember to clean your stethoscopes before and after you use them each time. Let's check out the crate. Alright, so first thing we're going to look at is the radios. So here's our first radio. As you can see, the glow germ is still very much fluorescing. So, let's see if I can get a really good shot of that. So there is still some glow germ on that up on the top, but it looks like the body of the radio was cleaned fairly well. Now let's look at the keys, and looks like the keys were not cleaned probably at all, or at least not well enough. So I've actually picked up some glow germ on my hands just by handling it. So the keys were not cleaned very well. Let's look at this radio, and this one is still fluorescing pretty much the same way that we left it. So this one here was, it looks like it was not cleaned, and you can even tell, and it's maybe kind of hard to see here, but you can tell where the crew turns is pretty clean, but where they're not touching is not. So you can see just by doing that, I'm actually rubbing the glow germ off on my fingers. So the areas that the crews are turning, like when they're changing their channels or they're turning their radios on, that stuff the glow germ has come off of. Which unfortunately means that it is on their hands, as you can see. So it's transferred onto their hands, and then everything that they're touching as well. So you can see this set of keys here, the lotion is as well all over that. Yeah, so there's some, and you can see that comes off pretty readily, and then it gets all over my fingers as well. So now anything I touch, if I touch the bag here, or this glove was on the floor, then anything that I touch will turn luminescence. Now, the glow germ in this scenario was an employee who was sick and maybe getting snot everywhere or something like that. So this is germs that's now spreading throughout the truck and potentially to patients. So, alright, so here's the tablet. Let's open this up, and you can see get a good shot of that. Everything is still completely covered. So the keys themselves have been cleared off. But the stuff in between has not. So again, that means that they are tracking this germ to whatever they're touching. So as you can see, again, my hand has gotten pretty nasty. So, and also the crew forgot to log off their EPCR. So remember to log off your EPCRs once you're done, or somebody might accidentally see your name and have access to your account. So the other thing is I wanted to look up in the front cab, but the front cab was actually pretty clean. So it doesn't look like they tracked much of it up there, and it also doesn't look like they tracked much to their stretcher. Or if they did, then they cleaned it really well in between patients, which is what we want to do.